Healthcare does not lack intelligence. It does not lack technology. It does not lack dedication. What it has lacked is structure that protects the professionals responsible for delivering care. For decades, the healthcare system has attempted to solve workforce strain with the same limited tools: resilience training, wellness programs, recruitment incentives, temporary staffing solutions. Some of these will actually help in the short term, but none of them address the structural problem. When professionals operate in high-risk environments without protection, the system eventually becomes unstable. The future of healthcare will not be determined by how much pressure clinicians can absorb. It will be determined by whether we build systems that protect them while they do their work. That is the purpose of the Nursing Special Forces Association. So the NSFA approaches healthcare reform differently. Instead of focusing on only symptoms, it focuses on infrastructure. The same way high reliability industries protect operators working in dangerous environments, healthcare must begin protecting the clinicians responsible for the care. The NSFA framework focuses on 5 structural pillars. Number 1 being psychological safety as patient safety. In high-risk environments, silence is dangerous. If professionals hesitate to raise concern, small problems become large ones. NSFA works to establish systems where clinicians can escalate safety concerns without fear of retaliation or professional harm. Psychological safety is not about comfort. It is about ensuring that the people closest to the problem are empowered to speak before harm occurs. Number 2, employer-independent escalation channels. Many healthcare workers hesitate to report safety concerns because their only pathway is through the same organizational structure responsible for the conditions that they are reporting. The NSFA aims to establish employer-independent channels where clinicians can surface systemic risks responsibly, constructively, and without jeopardizing their careers. This protects both clinicians and institutions by identifying problems early. Number 3, operational intelligence from the front line. The people who understand healthcare system, the risk best, are the professionals delivering care every single day. But their insights are rarely translated into structured intelligence that can inform leadership or even policy. The NSFA's long-term goal is to build a national model that converts frontline experience into actionable insight that strengthens healthcare systems. Not anecdote, not outrage, data, patterns, operational intelligence. Number 4, leadership training for high reliability systems. Healthcare leaders are often promoted for clinical excellence or even administrative capability, but managing high-risk systems requires specialized leadership training. NSFA promotes leadership development rooted in high reliability principles, accountability, after-action review without blame, transparent escalation, operational learning after failure. These are the same principles used in aviation, nuclear, power, and special operations environments. Healthcare deserves the same discipline. Number 5, national representation for the clinical workforce. Healthcare policy reshapes the conditions clinicians must work within. Yet the people delivering care are often the least represented in those conversations. The NSFA intends to help bring frontline operational reality into policy decisions at the legislative and congressional level, not through partisanship, but through informed representation. Policies that protect clinicians ultimately protect patients and strengthen healthcare systems. So, why this approach matters? Healthcare reform is often discussed in terms of policy, funding, or technology. Those issues matter. But none of them will succeed if the workforce responsible for delivering care continues to erode. A stable healthcare system depends on a stable workforce. And a stable workforce requires protection, structure, and accountability. So here's the future of healthcare. The next era of healthcare will not be defined only by innovation. It will be defined by whether the systems learns to protect its operators. Because the truth is very simple. When clinicians feel safe enough to speak, systems improve. When professionals feel supported, they stay. And when the workforce stabilizes, patient safety strengthens. The NSFA exists to help build that future, not by replacing healthcare institutions, but by strengthening the infrastructure that protects the people working inside of them. So the mission ahead. The Nursing Special Forces Association was built with a clear mission: to protect clinicians, to strengthen healthcare systems, and to ensure that the professionals responsible for delivering care are never expected to carry that responsibility alone. Healthcare does not need louder outrage. It needs stronger structure. And the future of healthcare will belong to the systems that learn how to protect the people expected to hold them together. That is the future NSFA is working to build.